Good morning. I'm Dr. Joe from Boca, and I'm wondering how I can be of service to you today. I'd like to share something with you that I think is very important. One of our readers in our video talk community sent in a question the other day, and I would like to respond to it. She wrote that she has two teenage children, and as the kids have gotten older, she's become more concerned as she tries to figure out what behaviors that they are exhibiting are normal teenage adolescent behaviors, and when should she be on the lookout for the onset of any kind of depression. And I'm very thankful to this reader because I think it's an important question. So I want to share a couple of thoughts with you that I think will help you when thinking about your teenagers. And if you can read this, when I trained up at Mass General Hospital in Boston many years ago, we used this acronym, oh there we go, we used this acronym to try to help look for the onset of depression. And the acronym stands for some very important key physiological indicators that I think you should have, rather keep in the back of your mind. We pronounce it SIGI CAPS, and let me just run through this for you. Number
Virus
one.
database has been updated.
Number one, we want to look for any kind of sleep disturbance. And again, sleep disturbance can mean that a child or an adolescent has difficulty falling asleep, that he or she has difficulty sleeping through the night, or if you find your teenager up early before he or she has to get up in the morning, then we start thinking about a sleep disturbance. Also, of course, is the obvious situation if your adolescent is coming home and trying to sleep and take long naps in the afternoon. So the first thing we look for is any kind of disturbance in sleep. The I in SIGI CAPS stands for interest. Be on the lookout for a loss of interest. So whether your son or daughter is an athlete or musician, an artist, whether they like going out with their friends, etc., if you start to see that he or she seems to have lost interest in things that have always held their interest, then that could be a sign that there's a greater problem. The G stands for guilt. Does your child seem to be expressing lots of guilt? Does he or she seem to be ruminating about guilt or feeling responsible for things that are happening, etc.? The E in SIGI CAPS stands for energy. Do you see any sudden major changes in energy? Now, often we think about a loss of energy or the onset of fatigue, but it can also be in terms of very, very manic kinds of energy. So far in SIGI CAPS, disturbances in sleep, loss of interest that things hold their interest. Does your child seem to feel very guilty about things? Are there changes in energy? The C stands for concentration. Are you finding that your adolescent is having a hard time focusing and concentrating not only on school and academic tasks, but other important tasks in their life? A stands for appetite. Are you seeing changes in appetite, especially the diminishing of what normally has been a good appetite? P stands for pleasure. Does your child seem to be having or experiencing or talking about there's an absence of pleasure in his or her life? And of course, S stands for suicide. Suicidal thoughts, suicidal ideation, suicidal plans. And folks, always take this very, very seriously. Your child needs to know, your teenager needs to know that he or she can bring up any thought on their mind without any kind of fear of repercussion. So it's normal for teenagers to isolate themselves. It's normal for teenagers to sometimes want to pull back, etc. But be on the lookout for SIGI CAPS, disturbances of sleep, lowering of interest, guilty ruminations, lowering of energy, difficulty in concentration, changes in appetite, what seems to be a loss of pleasure, and of course any kind of suicidal thoughts or activities. So again, this is not an exhaustive list, but hopefully when you think about your teenage sons and daughters, you'll have more of a sense of how to try to figure out, is this a normal phase or do I need to be concerned? And again, anytime you're concerned about depression and a child, and especially a teenager, get some help right away. So again, I'm Dr. Joe from Boca. It's been a pleasure talking to you this morning. If you feel this is helpful, please press share and pass this along, and I hope you have a great day.